Do you remember what it was like when you were a child and you fell down and you had the wind knocked out of you? That's exactly how I felt 7.5 years ago, at the age of 55, when I received that diagnosis. Laurie, I am so sorry you have pancreatic cancer. I'm Laurie MacCaskill. As I mentioned 7.5 years ago, my first symptom was kind of like an electric bolt through my body. It started at my head and it went through my body. It only lasted about 5 seconds. What remained was a pain in my lower back, about the size of a tennis ball, often debilitating, mostly annoying. Doctors told me I had gas, take an enema. Stop exercising, you've pulled a muscle. None of this I believed. I kept going back for tests. I was losing weight. I've always been this size, but I lost a lot of weight, under 100 pounds. Now, this is really not a problem for a woman, is it? I didn't think so. I kept asking for tests thinking I had an infection. I never once thought of cancer. I just don't think like that. I begged for tests. Finally, I was diagnosed. I met with my oncologist and with Dr. Reber. Because the cancer had spread, it was decided that I would go start with chemotherapy. After a short while, that was thwarted because I had a biliary obstruction. I had a surgery for a stent. That was not successful. Several hours later, they did the second surgery. I woke up in the middle of that. That was awful. When I came out in the recovery room, the first surgeon said to me, "If you were my daughter, if you were my wife, I would insist you have the Whipple surgery as soon as possible." Fortunately, 3 days later, I was in the very capable hands of Dr. Reber. I was in the hospital for 7 days. On day 6, I have to say, Dr. Reber came into my room in that starched white coat and the smile on his face, and he opens the door, and his eyes were so wide, and he looked at me, and he looked at the room, and he said, "Well, I guess this is what my wife does, but I've never seen this in the hospital." I had 2 women in their starched white coats doing their magic, giving me a manicure and a pedicure. I then started on a very aggressive, toxic protocol of chemotherapy for 3 years. I had, as many of you have experienced, every unimaginable side effect: ports, PICC lines, paddles to start my heart, emergency room visits too numerous to mention. I lost my eyebrows, my eyelashes, and my hair twice, very devastating for a woman. After the chemo for 3 years, I was told by several doctors that my cancer had spread to my liver and that chemo was no longer effective. To get my affairs in order, I had 3 to 6 months to live. I chose another route. I had treatment for 30 days, an infusion twice a day, and that was about 4 years ago. I have not been on any treatment since. My markers are perfect, and I have also discovered a wonderful organization for me that I've become very involved with, the Pancreatic Cancer Action Network. About 6 months after my surgery, I went to their symposium, very similar to this, and I'm not a group type person, so I sat in the back row planning my escape route. I really didn't want to be in a support group, and I just didn't want to share. But I met the most wonderful people, and just like today, I met people and doctors and scientists that shared wonderful information. I knew nothing about the pancreas when I was diagnosed. So I became informed. It was stimulating. I felt safe. I felt nurtured. It was a wonderful experience. I have since been on the board, and I'm now chair of the board. I travel the country. I make speeches. I interact with patients and caregivers. I lobby in Congress on behalf of all of us for research funding. I've done television and radio interviews on behalf of clinical trials. It's a wonderful organization, and again, where we have the patient and liaison program, as it was mentioned earlier, where people can call in and talk with a trained associate, get support about trials, medical research, diet, and nutrition. So all of that has helped me in this very challenging journey. But I also think you change the way you think will change the way you feel. And I have never, ever thought that I was sick, and I won't buy into this. I feel great, and I'm grateful to be here. Thank you.